นี้ติดตามข่าวภาษาอังกฤษกับคุณเทพชัยหย่องค่ะ
In a move that is likely to draw flack from critics, the government will hand out cash to people who are affected by the coronavirus. Prime Minister Prayut Chan-o-cha said the measure was adopted during a meeting of the economic minister today. He said each person will be entitled to a cash handout of 1,000 baht a month for 2 months. He said details on who will be qualified for the handouts and how they will be distributed are being worked out. The Prime Minister described the cash handout as a short-term measure to ease the impact of the virus outbreak, a measure he said is also being introduced in other countries. He was apparently referring to Hong Kong and Singapore, where people are being given cash handouts to cope with the economic downturn caused by the virus. He said the government is also working on tax, monetary and fiscal measures to help small and medium-sized businesses as well as other sectors of the society affected. Have trust in the government, he said toward the end of the press conference to formally announce the measure. Meanwhile, government authorities are trying to allay fears that Thai workers who have returned and will be returning from South Korea will aggravate the epidemic in the country. The fears have been further heightened by reports of some of the returnees going out in public places without observing the 14-day required self-quarantine. The latest case involved a woman in Chiang Mai who recently returned from South Korea and within the next 2 days posted pictures of herself on Facebook dining and drinking in a local pub. It triggered a hunt for the woman by health authorities in Chiang Mai. She was eventually located today and luckily was found to have no symptoms of infection. After having apologized for what she did, she was ordered to quarantine herself for 14 days. The Foreign Ministry reported early this week that at least 5,000 Thai workers in South Korea have registered with Korean immigration to return to Thailand. Prime Minister Prayut today tried to calm down fears that these people would be a health hazard by insisting that all the returnees will be subject to strict screening and quarantine. But where these people will be quarantined once they are back in Thailand is a big question. The Royal Thai Armed Forces headquarters has stepped in to offer its facilities to help house the returnees during the quarantine period. One of them is the resort it owns on the famous Chao Samran beach in Mueang district of Phetchaburi province. The plan, however, immediately prompted a strong protest from several local business and administrative bodies in Phetchaburi out of fears that it would ruin tourism in the province. A statement signed by representatives of 11 groups, including the Provincial Chamber of Commerce, media organizations and tourism businesses, asked the government to review the plan. It said under the current economic situation, tourism is the only sector that is saving the province. But the plan to locate the returnees from South Korea there would scare off tourists. It's still unclear as to how many more of Thai workers will be returning to Thailand from South Korea. Government spokeswoman Narumon Pinyosinwat said today that South Korea has agreed to a request from the Thai government that it closely monitors Thai workers seeking to return home. She said the Thais will be monitored for 14 days before being allowed to leave South Korea. Anyone found to be infected will be treated first. The request was made by Foreign Minister Don Pramatvinay in a phone call to his South Korean counterpart, according to the spokeswoman. Meanwhile, the shortage of surgical masks continues to be a subject of debate. Thai PBS World has received numerous complaints that, despite the government's denial, surgical masks are still in short supply at most convenience stores and drugstores. And there was some relief today as mobile units of the Internal Trade Department of the Commerce Ministry hit the streets to sell surgical masks. There were 21 sale points in Bangkok, where a package of 4 masks was sold for 10 baht. The masks will be made available to people outside Bangkok starting tomorrow. The department plans to make 300,000 masks available daily. Of course, Thailand is not the only country which sees a scramble for face masks and hand sanitizers sparked by the coronavirus outbreak. People in several other countries, from China to the US and Italy, have also been snatching up masks and respirators.
A cash handout policy announced by the government to give away 1,000 baht for 2 months. Is it the right policy or not at this very juncture? Thai PBS World Tonight asked Associate Professor Jet Thonavanik.
Did you know that the government is giving out more money, 2,000 baht for 2 months?
Yes.
I'm not sure whether you will be qualified for that or not. But what do you think of the idea?
I always not in agreeing with giving out money directly, because in giving out money directly, it's only in a very special need situation. For example, if there is a vast problems or there is sort of a tsunami like that, or if there is a widespread of problems in flooding, all those things, then that's fine. Okay. But not in pandemic situation like that you give out 2,000 baht. Why? For what? It doesn't make any sense. In terms of giving out 2,000, what will it help? For example, if you get 2,000, let's say if Mr. A is sick, getting 2,000 then what? You can't go anywhere.
All at once.
Yeah, that's right.
They said they want to stimulate money and help small and medium-sized business operators.
I think they should prepare what will happen after this pandemic of this COVID-19. Because at this time, it is a time in which everybody does not know yet what to do.
Okay.
Everybody is in a chaotic situation in which we don't know whether we are being upgraded from level 2 to level 3, and what will happen next, how long will this last. They have to prepare. Once the situation is settled or the situation fades away, then the situation afterwards will be economical important, because if they cannot drive the economy at that time, if they have no plan whatsoever for everybody, especially the small and medium-sized enterprises as well as the small and medium people, then that will be a problem for them.
Okay. So the priority now is to identify the extent of the epidemic that we are facing and try to address what we are facing.
And I think the government is very lucky that our medical personnel, doctors, nurses, as well as all the others, are very well prepared, and all the establishment in public health are very good in terms of dealing with the situation, the epidemic and the pandemic problems of all these diseases, especially the disease that is very unknown and we don't know yet of how to cure such disease. Our medical personnel are very well equipped. So in this situation, the government can ride upon them and not having to do too much or so much in order to deal with the situation. So that's lucky for them. But afterwards, all these people will not be able to help with the economy.
And that's all from Thai PBS World Tonight.